Hi, my name is Alexis Zarazua, and I'm an S2 nursing student at Concordia University, Texas. And today I will be discussing my health fair over adult CPR. What is CPR? CPR is cardiopulmonary resuscitation and takes place in a person who is in cardiac arrest. This is an emergency procedure consisting of chest compressions and ventilation to a person and works by maintaining blood flow in the body until medical assistance becomes available. A little about CPR. It's as easy as CAB. Compressions, airway, and breathing is the order of importance when it comes to CPR. Compressions. Push hard and fast on the center of the victim's chest. Airway. Tilt the victim's head back and lift the chin to open the airway. Breathing. Give mouth-to-mouth rescue breaths. Now that we know a little bit about CPR, let's go ahead and dive into the demonstration. Hi, and welcome to your demonstration of adult CPR. I will be covering only adult CPR and not CPR on children, babies, or toddlers. So the first thing that you want to make sure is how to give proper CPR. What does that look like? So, first thing you want to look at is your hand position. Now you want to use both of your hands here, and you want to have one flat and another one on top of each other, and then you're going to interlock your fingers in between your second hand, and this is how your hands should look. Now, when giving CPR, let's say for instance that this is the chest, you want to put your hands in between the breasts, and this is going to be about right here, and you want to be on top of the sternum. So, in the center of the chest. Let's say that this is our two breaths, and this is the center of the chest. This is where you want to go, okay? Your two breaths, here's the center. Now, with your hands, you're going to put them right in the center in between, and you also want to be sure that whenever you're doing compressions that you're using this part of your hand, as it's going to be the most accurate whenever you're trying to get depth and you want to do adequate chest compressions. Okay, next is going to be your body position. You want to make sure that you're giving adequate compressions, and that way you also won't tire out as easily. So remember, we discussed how we're going to have our hands, okay, and this is going to be centered on the chest. So for this instance, this is going to be the center of our chest. And when we're thinking of the center of the chest, we're thinking in between the breasts, and it's going to be in the sternum area, okay? So about right here is where you want to start and give it. Okay, now, for your body position, you want to make sure that your back is straight and your shoulders are directly over your hands when you're hunched over, and you might make sure that your elbows are locked. So, when you're on top of somebody, you should look like this, okay? You should be straight. Here are my hands, okay? And you want to make sure whenever you're giving these compressions that you're falling straight through into the back with your elbows locked, your hands straight, and that you're using your back to give the compressions and not your hands or your arms. You're going to mainly be using all the pressure from your back to get into those compressions, and you're not moving or shrugging your shoulders, you're just using your back. Okay, now let's talk about the depth. So the depth that you want to do is at least 2 inches. So when we talk about this, we mean the depth that you're going into the chest. So let's say that this is the chest, and you want to go at least 2 inches, which is about this far, okay? So that's how you know that you're giving adequate compressions. If we are not going deep enough, then we are not pumping hard enough, so there's not enough blood circulating throughout the body. And that is the main importance of why we're doing CPR. Okay, so now for the rate. You want to do at least 100 to 120 beats per minute. So it's gonna be pretty fast. Now, a lot of people like to use the song Stayin' Alive by the Bee Gees, and that's what gets them going to make sure that they're going quick enough. What I like to do is I like to count to myself in my head, and I like to count and 1 and 2 and 3 and 4. I think that that is a good, accurate enough way to make sure you're doing the rate fast enough, and also you're not having to sing the song the whole time. That's just my preference. So, for the rate of 100 120 beats per minute, I like to do and 1 and 2 and 3 and 4 and 5 and 6 and 7 and so on. Another thing to remember, whenever you're giving these compressions, you want to allow the chest to return to its original position after each compression. So you don't want to go too fast to where you're not allowing the chest to come up, because we have to make sure that you're giving that heart a chance to fill up with blood and then pushing more blood throughout the body. So that's another important thing when you're considering the rate and giving compression. Now that we have gone over the CPR positioning basics, let's go over the CPR steps. So first, what you want to do is check the scene for safety. You want to form an initial impression and use personal protective equipment if need be. Always make sure that you are in a safe place to even be performing CPR. Next, check for responsiveness, breathing, life-threatening bleeding, or other life-threatening conditions using shout, tap, shout. So you want to first approach the person and do they look unresponsive to you? If they are, go ahead and tap and shout them. And if there is no response, check for a pulse. If there is no pulse, we're going to move on to the next step. The next step is to call 911, get equipment, or tell someone to do so. So if the person does not respond, is not breathing, or only gasping, you want to call 911 yourself, or what I actually recommend is if there is more people in there with you, you want to look at someone straight in the eye and tell them, call 911. And then you also want to look at another person straight in the eye and tell them to get the AED. You want to make sure that they understand this and they are looking at you completely. If you are the only one in the room at this time, go ahead and call 911, and while you're on the phone with 911, we can get started on the next step. The next step is to place the person on their back on a firm, flat surface. You want to ensure that before you give CPR that the surface is going to be a hard surface. That way that your compressions are going to be adequate enough for circulation. The next step is to go ahead and start CPR. So you're going to give 30 chest compressions. And remember, when giving these chest compressions, you want to take into account our CPR positioning basics, which is your hand position, body position, depth, rate, and to allow the chest to return to normal position after each compression. After you've done your 30 chest compressions, go ahead and give 2 breaths, okay? And that is going to be our next step, which is step 6. After you've given those 2 breaths, you're going to continue giving sets of 30 chest compressions and 2 breaths. And you also want to use an AED as soon as one is available. Some things to note whenever you're giving CPR, to make sure that you do head tilt and chin lift technique so that you can ensure to open the airway whenever you're giving those 2 breaths. And you also want to ensure that CPR is very exhausting. It can be very tiring, and sometimes whenever we're giving CPR for a long period of time, we're going to stop giving them adequately. So if there is other people in the room, you want to have someone make sure to know that they're probably going to be next in giving CPR, or you're going to have to switch out. If you are too tired and you're the only one in the room giving CPR with the victim, just go ahead and keep giving it until you are unable to do so. Now that we have gone over the CPR positioning basics and the CPR steps, let's go ahead and put this together and act out a scenario that could occur when giving CPR. Okay, so first and foremost, you want to check the scene for safety and form an initial impression. Everything seems to look good. So now you're going to check for responsiveness and for shout, tap, shout. You want to see if the patient is breathing or to see if there is a pulse. There's no pulse. So now you're going to look at someone in the eye and say to call 911 and get the AED. And then you are going to go ahead and start giving CPR. Now, you want to ensure that the person is on a firm, flat surface, which we are here. And you're going to start giving 30 chest compressions and 2 breaths. Now, you want to take into account your hand position, your body position, the depth, and the rate, and to allow the chest to return to normal position after each compression. When giving 2 breaths, you want to ensure that you are lifting, doing the head tilt chin lift technique, and you are allowing the chest to rise, and make sure that you are actually perfusing them with enough air. If you do not have a device that you can give them breaths, it's okay to use your own breath, and if you would not like to, you do not have to either. After you've done your 2 breaths, continue giving sets of 30 chest compressions and 2 breaths by counting. Now I will show you how to get CPR certified. You're going to go to AmericanHeartAssociation.org, and on the top right corner on the 3 little lines, you'll tap that, and you're going to scroll down to CPR, and you're going to click on Find a Course. After you've found a course, you're going to scroll down and filter out your search. You're going to select your audience. You have the option of doing general community or healthcare professionals, depending on what you're going to be getting certified for. For this presentation, we're just going to do general community. For your topic, you can do adult CPR, basic life support, or CPR AED. Also, it's your preference. For this presentation, we'll just do adult CPR. And for course format, you have the option of doing classroom or online in classroom. For this presentation, we're just going to do classroom and search. You will now scroll down and view your purchase and training options and find a class. Now, this is going to find some classes near you. What you can do is also allow the website to look at your current location so that it can find something near you. Now, what you're going to do is pick a class for you. Now, you can pick something that works on your time and your date, whatever is available for you. And there's also a way to get it in a different language other than just English. So this class is closed. So now we will go to the next one. And this one's open, and we'll go ahead and reserve that. And now you will just fill out your information and reserve the class and get CPR certified. It is time for the post-test to test our knowledge over today's presentation. What is the rate to achieve during CPR? The answer is 100 to 120 per minute. How many chest compressions? 30 chest compressions is the answer. What is the order of importance of CPR? The answer is CAB, compressions, airway, and breathing. What is the first thing you should do when you suspect a person is down? The answer is to check the scene for safety. Remember, we want to make sure the area is safe for us to even start CPR. Thank you for tuning in to this health fair presentation over adult CPR. I hope that you were able to gain some knowledge on how to do CPR and feel more comfortable if you're ever in this situation to perform it. I hope that you take this knowledge with you and go and save some lives.